plastic and reconstructive surgeon here at Pure Plastic Surgery in Miami, Florida. I have a special announcement at the end of this live. I would love for you to stay tuned till the end so we can talk about that. But right now we're going to be going over some questions about combining surgeries, what's safe to do and not do. So I'm going to jump right into that. I have some questions here and we'll get going. Can I combine breast surgery with liposuction? Yes, you can. That's actually a really good combination to do. The one caveat to that, here in the state of Florida, whenever we're doing a cutting procedure like a breast procedure, we're limited to 1 liter of liposuction. So it's a really good combination if you need just a little bit of additional liposuction to the anterior abdomen or flanks or something like that, or sometimes even when we're doing breast surgery, the subaxillary area or over on the side of the breast. It's a great thing to combine. Is it safe to have a tummy tuck and breast lift in one surgery? Yes, it's absolutely safe and we do that all the time. The thing to think about is limiting time under anesthesia, so as long as your surgeon is able to do it efficiently without being under anesthesia for a super prolonged period of time, it's a very safe thing to do. How many procedures can I have done out in one visit? This is variable from person to person because every procedure can be a little bit different. I can do a tummy tuck where it's super small patient with a small incision, or I have to do big extended tummy tuck. And so again, it goes back to the time under anesthesia, what we can do safely, and typically under 5 hours is my goal for any surgery in the outpatient setting, because anything longer than that, it should probably be done in the hospital and you should be staying overnight for observation. What are the risks of combining surgeries? So just kind of talked about one, the risk of just being under anesthesia for a longer time, and risk of DVT, that kind of stuff goes up if you're really under for a really long time. The other thing is to think about the recovery. If you don't handle pain very well, if we're operating on multiple parts of the body, it can be a little bit more uncomfortable having combinations of procedures, even though it's well tolerated by most patients. Will recovery be harder if I do multiple procedures at once? So yeah, it can be a little more challenging if we do breast, abdomen, or especially if we combine like brachioplasty and those other procedures, because you're going to really need some extra help getting up out of bed and getting around because you're going to be a little bit sore in multiple areas. Should I wait between surgeries to give my body time to heal? Absolutely. So when we're staging procedures, like if we do a mommy makeover with a tummy tuck and a breast lift, and then you want to come back later for a lipo 360 or something like that, we should be waiting a minimum of 3 months, but typically about 6 months is a good time to wait in between procedures. Can I have a facelift and body contouring surgeries together? I personally don't think this is a great idea because those are surgeries that tend to be a little bit longer, the facelift portion of it, and so I think that would be a little too much to combine into one thing. And again, those are different parts of the body that are trying to recover at the same time, so I don't think that's a great combination. With that being said, doing eyelids is a very short procedure that we can add on to almost any procedure. It's something that can be done locally in the office, so doing upper blepharoplasty or something like that is not a huge deal to combine with other surgeries. Will combining surgeries affect the final results? Yes and no. So you have to combine the right procedures to get great results. So combining a breast procedure and a tummy tuck is a great combination because the recovery is similar for both of those procedures. Combining a tummy tuck and a BBL, not a great idea because those are two kind of competing procedures for the recovery. For the abdominoplasty, you need to be laying in a recumbent position. For a BBL, you need to be laying on your stomach. And we can't really do both of those things ideally in the same surgery, so I don't perform those surgeries together. How do I decide which surgeries should be done together? Again, this is part of the consultation process with your surgeon, and he can walk you through what's the best option for things to consider combining together. And again, just looking at the total amount of time under anesthesia and which recoveries go together the best. What's the benefit of combining surgeries instead of doing them separately? Less times going under anesthesia, even though anesthesia is super safe, but it's just less downtime in between, so you don't have to recover multiple different times. You can get more done in one shot. All right, so that's the questions I wanted to get to. Now the big news that I have to share is
drums.
Many years of hard work, studying, residency, fellowship, medical school. The final part of my board certification was my oral boards for the American Board of Plastic Surgery that I took back in November. And I just got news today that I have officially passed that. I went from a board eligible plastic and reconstructive surgeon to a board certified plastic and reconstructive surgeon. This is my second board certification. I was previously certified with the American Board of Surgery for my general surgery. And this is a huge sense of relief. This is the first time in my adult life I don't have a pending giant examination hanging over my head, and it's a totally new feeling for me to have that level of freedom. And I'm looking forward to serving all you guys. I also want to say, it's important to have a board certified surgeon do your surgeries, but I always thought that was a little bit hypocritical for people to say all the time, because there is one scenario where your surgeon might not be board certified, and that's when he might be board eligible like I was. So I want to assure all of my patients that had surgeries with me over the last 2 years that I was fully trained. I completed all the required training, and this is just part of the certification process for the American Board of Plastic Surgery. You have to take a written examination.
Oh!
Woo! Everybody, appreciate it.
Come in to the end of the line. Come on, girls.
This is the staff. Everybody's really excited because a lot of work goes into this, and everybody here at Pure Plastic Surgery was part of that. And like I was saying, it's not that I wasn't a trained surgeon before this moment, it's that I was board eligible, and this is part of the process for the American Board of Plastic Surgery, that you need to take a written examination, then you need to collect a certain amount of cases to submit those, and then you go for an oral examination where they test you on your own cases and a bunch of unknown cases. That is all done behind me, double board certified, super excited about it. Thank you, everybody. Appreciate you all.
Well, bye-bye.
Come check us out at pureplasticsurgery.com.
Bye.
All right.